hear the word cancer, they think of radiation, hospitals, like all the bad stuff about it. It really is a serious disease, but there are a lot of people who don't necessarily have to live in hospitals to deal with cancer. You've all seen this picture, right? The breast cancer ribbon. There's a red one for heart disease, the yellow one for leukemia, pink's for breast cancer. Actually, 1 in 8 women in the U.S. develop breast cancer during their lifetime. So I counted, and about 2 of us in this entire room have a chance of developing breast cancer. Granted, it's mostly hereditary, so if you didn't have it in your family, you probably won't develop it. I actually had it in my family. My grandma had breast cancer, and my mom had a suspicious lump. So she had to get surgery instead of my grandma. But it does affect you physically, mentally, and emotionally. And it is a hard disease to live with. Some physical effects. Chemo, radiation, and prescription medications are the common ways to treat it. But those can cause weight gain and weight loss, as well as hair loss. And your weight gain/loss can cause your body to feel weaker, so you have to change your diet. When you change your diet, you have to eat high-protein foods to keep up your strength, and also to prevent weight loss. Smaller portions can contribute to that weight loss, so your appetite might not be as big, so you have to eat smaller portions throughout the day. Some suggestions are to eat your main meal at the beginning of the day when you may feel stronger, and then have smaller portions and meals later on as the day continues. Along with these physical effects also comes some emotional effects. You see your body changing, you're not really used to seeing your body change so rapidly. You change as a kid, but it's over like a period of like 10 years. So like, oh, you don't remember exactly change, you live yourself in the mirror every day for, I don't know, those years, 13 to 18, but you don't really see your body changing as you do with breast cancer. When people are diagnosed, they get fearful, anxious, they begin to think that they'll never get better, they begin to question their happiness. One of the main questions is actually, will my body ever be strong enough to do what I usually do? Can I go rock climbing like I used to? Can I go walk on an afternoon with my grandchildren or my children? And sometimes that's not an option because your body is weaker, so you do need to rest. You do need to stay at home. There's also the loss of the support of the hospital staff. Having your family there is nice, but also there's doctors and nurses who know exactly what's going on with your body, can tell you what's going to happen later on, and can give you that support. And once you leave the hospital, you do get a sense of abandonment. You do need that information. You feel like you're not having enough information. No one can really tell you what's going to happen, especially your family. So these emotional effects also do take a toll on your mental health. Those patients who are diagnosed with cancer do develop a sense, or not a sense of, but like kind of a mental confusion, delirium, mostly memory loss. It's the most common sign of medical complications of cancer or with treatment, and it's common in 15 to 30% of patients diagnosed with cancer and 85% of patients in their last few weeks of life. Most of the things they lose are names, dates, faces, places, memories, stuff they don't really see too often or on an everyday basis. Some side effects include being sleepy or withdrawn, agitated, memory loss, disorientation, depression. So most of the people who do experience stuff, their family tends to be more patient with them, because they may have to remind them over and over again that, oh, this is your child, this is your mom, this is your brother, your husband, because of his mental confusion or delirium. So in conclusion, breast cancer cancer in general does have a toll on your mental, your physical, and your emotional health. It really does take a lot of out of you. My grandma, actually, when she had breast cancer, she did a lot of surgeries, a lot of recovery days, a lot of surgery, a lot of recovery days, a lot of missing work, a lot of working from home. She works for the Pentagon, so it's kind of hard to do her job, especially when you have a security clearance that she does. And you work at home, you don't have the access to the files you need, you don't have access to the people you need to talk to. My mom actually flew out to Virginia one of those days that she had surgery and stayed with her for a period of about 2 weeks to help her recover and to help her. They actually went to the Cherry Blossom Festival. Kind of mad about that, because I didn't go. But then again, I was in 6th grade, can't really miss school. Of course. So, but actually, since 2007, she's been breast cancer free. So my mom even got a little paperweight, and has a little breast cancer ribbon etched into it, and it says breast cancer free since 2007. But even though she is breast cancer free, she does have to go to the doctor periodically to make sure her health is where it needs to be. She is fairly young, but it's a serious disease. And my mom has to get screenings every once in a while. I'm sure I'll have to get screenings because it is a hereditary disease. So just thinking that you know that living with breast cancer is really hard, but you don't really know how hard it is until you have to live with someone who actually has it, or you have to live with it yourself.